Professor Donna Hartz is leading the Western Sydney University and Western Sydney Local Health District Midwifery Research Centre. Unfortunately, she isn't able to be here, but she has prepared a slideshow presentation, which we'll share with you now, which will give you a snapshot of what's happening in Western Sydney LHD.
Hi there, I'm Donna Hartz. I'm Professor of Midwifery and Chair of Midwifery at Western Sydney University, Western Sydney Local Health District Midwifery Research Centre. I am blessed to be clinically immersed in this building, which is at Blacktown Hospital. So being clinically immersed as a conjoint, which means that myself and my research team get to work very closely with midwives and clinicians in the maternal infant care space on projects affecting the local community. So the Research Centre is a joint venture between the two entities, and we're trying to build capacity in midwifery research, but also work closely with nursing and other medical and allied health on various projects. And we have a strategic focus on promoting the health and well-being of mums, babies and families in Western Sydney. We have one of the most diverse and disadvantaged and for the most part quite a vulnerable population. We're one of the highest called population, Aboriginal populations, and also low socioeconomic populations. So there are a myriad of very complex life situations that are presented to our clinicians, and we work closely with them to try and improve the outcomes. So here's our midwifery research team. Alongside me there is Dr. Karen McLaughlin, who's going to be with you after this presentation to answer any of your questions. And Karen's our postdoctoral research fellow with a specialty in aspirin, pregnancy, midwifery education, parenting education, and workforce development initiatives. Our other research associate, Wambai Madzadza, beautiful Zimbabwean woman who trained in the UK and has been over in Australia working as an educator and now as a researcher with the centre. And her PhD that she's undertaking at the moment is on midwives' experience of personal pregnancy loss and return to work. Wambai is also the project leader of one of our major projects at the moment, the Cosmic Midwifery Student Clinic, which is a project that aims to build workforce capacity within, in particular, our continuity of care models. And we're hoping that this model will help to fuel and provide a pipeline into continuity of care models, which produces some of the optimal cares for mothers and babies. So as you can see, my main foci have been with midwifery continuity of care models that have produced that are now the gold standard in maternity care, and that we know that they improve the outcomes for mothers and babies irrespective of any risk. And also I focus on Aboriginal maternal infant health, and in particular health education pathways for all people into midwifery studies. Our centre brings a myriad of different research methodologies and experiences. We're quite widely published. As you can see, we've got quantitative, qualitative and literature review experience. And there's an example there, the National Midwifery Guidelines for Consultation and Referral, the work from the randomised controlled trial drove the development of that, and that document now underpins much of the policy, regulation and practice around Australia for midwifery care. So I think what we bring is quantitative, qualitative, mixed method, literature review, and also the translation of evidence into practice. We're currently advertising for within the local health district for nurses and midwives undertaking an honours degree. We have scholarships where you have your tuition fees paid at the university, and within the local health district you have one day a fortnight to undertake your studies over part-time over 2 years. Now, what will be coming up soon is 2 midwifery industry co-funded PhD scholarships. They're about to be advertised, so if there are any potential midwives thinking of undertaking their PhD, come and have a talk with me. These co-funded scholarships enables you to maintain your position within the local health district while undertaking your PhD in an area relevant to the local health district.